Hi, I'm Dr. Zach Trzaska. I'm one of the new cardiac doctors here at Waldo County Hospital. Today we're going to be going over some basic cardiac conditions and demystifying some of the terms that you might hear. So the first term that we're going to talk about is atherosclerosis, hardening of the heart arteries. Some people call it coronary artery disease. And what this is over time people have arteries in their heart that will have a buildup of plaque. Some of them have a cholesterol plaque. It's just plaque over time that builds up in the heart arteries. And over time the heart arteries can get narrow. It's kind of like a pipe that has buildup over time. The narrowing will cause decreased blood to flow to the heart, and that can cause symptoms as chest pain or tightness. Sometimes people get shortness of breath when the blood doesn't flow where it needs to go. This is a very common condition. A lot of people have this, and over time it becomes even more common, and people will end up getting these symptoms in most cases. So the next term we're going to talk about is something called atrial fibrillation, and it's a rhythm problem of the heart having to do with the electricity. Sometimes people call it AFib, and it's, again, a very common heart condition that a lot of people have. As you age, it becomes even more common. People in their 90s a lot of people in their 90s will have atrial fibrillation. What it is the top chambers of the heart. Normally electricity goes from the top chambers down to the bottom chambers in a very organized fashion. You have the top chambers, the electricity goes through and they beat, and then the two bottom chambers will beat after that. So the top chambers will beat and the bottom chambers will beat. In people with atrial fibrillation, the electricity in the heart is a little bit off in the top chambers, and instead of beating in a normal, concise fashion like this, you have just irregularities of the heart. And these irregularities over time can cause people to feel symptoms of palpitations, their heart beating really fast. Some people feel short of breath with them. The other part of atrial fibrillation is when your heart, the top chambers are beating just like this, you can get blood that pools in those top chambers, and that can cause people to have strokes and things like that. So again, this is a very common condition, atrial fibrillation. It has to do with the electrical system of the heart, and we tend to see this quite frequently as people age and get older. All right, so the last term that we're going to talk about is something called heart failure. This is a term, sometimes people will say heart failure with systolic dysfunction. There's another term, heart failure with diastolic dysfunction. The first term, heart failure with systolic dysfunction, just means that the heart is not pumping well, it's not squeezing well. It's like a balloon that's been overinflated and just not able to squeeze. The other term is heart failure with diastolic dysfunction. This is when the heart is just very stiff. Sometimes it tends to be thick and it doesn't fill very well. The end result of both of these terms, or both of these conditions, people tend to feel short of breath when they walk, when they exert themselves. People feel short of breath when they lie flat, and that's just because of fluid that builds up. The heart is a pump, and when the pump doesn't squeeze normally or doesn't fill normally, fluid is going to back up on the lungs, and people will tend to feel that. It's not as common as the other two conditions that we had talked about, but it still is fairly common, and we do tend to see it. And the result and of what we do is we treat this usually with medicines, and people tend to do fairly well with medical treatment. There are some advancing therapies, especially with heart failure with reduced ejection fraction, systolic dysfunction, that are coming down the pipeline that are exciting. But for the most part, treatment is with medicines. And so that's it for our cardiac conditions. I hope this has helped demystify some of these terms that have been thrown out there. And I look forward to talking more about this in the future with Journey to Health.